Welcome to Howard Brown Online Barber College. Today, we will be reviewing men's facial massage and treatments. Let's begin. An example of an electric current modality is it electric massager, light emitting diode, galvanic, or heat lamp? If you chose C, galvanic, you are correct. Blank is an example of a heat modality. Is it microcurrent, low level light therapy, low level laser therapy, or infrared device? If you chose D, infrared device, you are correct. What muscle covers the back of the neck, allowing movement of the shoulders? Is it platysma, trapezius, sternocleidomastoideus, or triangularis? If you chose B, trapezius, you are correct. The broad muscle that covers the top of the skull is the blank muscle. Is it epicranius, frontalis, epicranial aponeurosis, or occipitalis? If you chose A, epicranius, you are correct. Which of the following is an example of a chemical modality? Is it galvanic, lasers, microdermabrasion, or microcurrent? If you chose microdermabrasion, you are correct. The muscles that coordinate opening and closing the mouth are the blank muscles. Is it buccinator, mentalis, risorius, or masseter? If you chose D, masseter, you are correct. Which of the following is the tendon that connects the occipitalis and frontalis? Is it epicranius, epicranial aponeurosis, corrugator, or procerus? If you chose B, epicranial aponeurosis, you are correct. What muscle is used when laughing? Is it zygomaticus major, mentalis, orbicularis, or oris, or triangularis? If you chose A, zygomaticus major, you are correct. What muscle bends and rotates the head? Is it zygomaticus minor, trapezius, sternocleidomastoideus, or platysma? If you chose C, sternocleidomastoideus, you are correct. A hot towel is an example of what type of nerve response modality? Is it massage, moist heat, or current? If you chose B, moist heat, you are correct. Heat and moist heat on the skin cause blank. Is it relaxation, contraction, stimulation, or constriction? If you chose A, relaxation, you are correct. Which of the following is an example of an electric current modality? Is it laser, infrared device, high frequency, or electric massager? If you chose C, high frequency, you are correct. What nerve is the chief sensory nerve of the face? Is it facial, 11th cranial, 7th cranial, or 5th cranial? If you chose D, 5th cranial, you are correct. The motor nerve that controls motions of the neck muscles is the blank nerve. Is it 7th cranial, accessory, trifacial, or 5th cranial? If you chose B, accessory, you are correct. The 5th cranial nerve is also known as the blank nerve. Is it cervical, accessory, trigeminal, or facial? If you chose C, trigeminal, you are correct. What nerve branches supply the muscles and scalp at the back of the head and neck? Is it trigeminal, 11th cranial, accessory, or spinal? If you chose D, spinal, you are correct. How many pairs of cranial nerves are connected to a part of the brain surface? Is it 6, 12, 18, or 24? If you chose B, 12, you are correct. Blank are vessels that transport oxygenated blood from the heart to all parts of the body. Is it venules, arteries, capillaries, or veins? If you chose B, arteries, you are correct. What arteries are the main sources of blood supply to the head, face, and neck? Is it superficial temporals, external maxillaries, common carotids, or posterior auriculars? If you chose C, you are correct. Common carotids. Which of the following transport deoxygenated blood from various parts of the body to the heart? Is it veins, arteries, nerves, or lymph? If you chose A, veins, you are correct. Blank is a stroking movement. Is it percussion, petrissage, effleurage, or friction? If you chose C, effleurage, you are correct. Which of the following is the most stimulating form of massage? Is it petrissage, percussion, friction, or effleurage? If you chose B, percussion, you are correct. What type of massage movements are the gentlest form of tapotement? Is it tapping, hacking, kneading, or stroking? If you chose A, tapping, you are correct. What massage movement exerts an invigorating effect on the area being massaged? Is it effleurage, percussion, tapotement, or petrissage? If you chose D, petrissage, you are correct. Which of the following should be used sparingly and not exceed a few seconds duration on any one area? Is it tapotement, percussion, vibration, or friction? If you chose C, vibration, you are correct. Blanks should only be used on the back and shoulders. Is it rubbing, hacking, slapping, or tapping? If you chose B, hacking, you are correct. What massage manipulation has proven to be beneficial to the circulation and glandular activity of the skin? Is it friction, percussion, tapotement, or vibration? If you chose A, friction, you are correct. In what type of movements are the lower points to midpoints of the fingers used to strike the skin lightly and rapidly? Is it tapping, hacking, chopping, slapping? If you chose D, slapping, you are correct. What type of massage movement stimulates the nerves to tone the muscles? Is it effleurage, petrissage, percussion, or friction? If you chose C, percussion, you are correct. Deep vibration with a mechanical vibrator or massager can blank. Is it have a relaxing effect, impart a healthy glow to the part being massaged, improve glandular activity, or stimulate blood circulation? If you chose D, stimulate blood circulation, you are correct. When electrical stimulation is applied to the nerve through electrodes, the muscle responds by blank. Is it contracting, expanding, relaxing, or stretching? If you chose A, contracting, you are correct. A blank point is a point on the skin where nerves that control the underlying muscle are located. Is it functional, motor, localized, or trigger? If you chose B, motor, you are correct. Which of the following is a beneficial result that may be obtained by proper massage? Is it muscle fiber is reduced, nerves are stimulated, circulation of blood is increased, or circulation of blood is decreased? If you chose C, circulation of blood is increased, you are correct. A trigger point exhibits hypersensitivity to blank. Is it chemicals, moist heat, light rays, or electrical stimulation? If you chose D, electrical stimulation, you are correct. Where is the immediate effect of massage first noticed? Is it in the nerves, blood circulation, in the muscles, on the skin? If you chose D, on the skin, you are correct. A beneficial result obtained by proper massage is that blank. Is it circulation of blood is decreased, muscle fiber is soothed, fat cells are reduced, nerves are strengthened? If you chose C, fat cells are reduced, you are correct. The blank of a muscle is the attachment point to a movable bone. Is it Trigger, insertion, base, origin. If you chose B, insertion, you are correct. Massage should never be recommended or employed when blank is present. Is it high blood pressure, low blood pressure, a hypertrophy, a keloid? If you chose A, high blood pressure, you are correct. Which of the following helps to soften follicle accumulation? Is it galvanic machine, high frequency current, steam, or brushing? If you chose C, steam, you are correct. The primary actions of high frequency current are thermal and blank. Is it systemic, tonic, therapeutic, antiseptic? If you chose D, antiseptic, you are correct. Overexposure to blank can destroy skin tissue. Is it alkaline pH products, microcrystals, ultraviolet rays, astringent solutions? If you chose C, ultraviolet rays, you are correct. Which of the following heats and relaxes the skin without increasing overall body temperature? Is it ultraviolet rays, infrared rays, microcurrents, galvanic currents? If you chose B, infrared rays, you are correct. Blank is the use of the positive pole anode to introduce an acid pH product into the skin. Is it cataphoresis, desincrustation, anaphoresis, iontophoresis? If you chose A, cataphoresis, you are correct. To perform desincrustation, a blank solution is applied to the skin surface. Is it alkaline pH, astringent, ion containing water soluble, acid based? If you chose D, acid based, you are correct. Which of the following is a form of mechanical exfoliation? Is it direct surface application, desincrustation, brushing, or steaming? If you chose C, brushing, you are correct. Blank produces fast, visible results and can be used to treat surface wrinkles and aging skin. Is it light therapy, microdermabrasion, anaphoresis, cataphoresis? If you chose B, microdermabrasion, you are correct. What is a type of galvanic treatment that uses a very low level of electrical current for applications in skin care? Is it microcurrent, microdermabrasion, ion tophoresis, desincrustation? If you chose A, microcurrent, you are correct. The high frequency machine can benefit the client's skin by blank. Is it deoxygenating the skin, decreasing blood circulation, decreasing glandular activity, or increasing cell metabolism? If you chose D, increasing cell metabolism, you are correct. A negative electrode is known as a anode, high frequency current, cathode, wavelength. If you chose C, cathode, you are correct. Ultraviolet lamps may be used to treat blank. Is it nerve disorders, wrinkles, dandruff, aging skin? If you chose C, dandruff, you are correct. Blank is are used to produce chemical and ionic reactions in the skin. Is it Tesla current, high frequency current, galvanic current, or ultraviolet rays? If you chose C, galvanic current, you are correct. Which of the following should never be performed on skin that has been treated with Retin-A? Is it light therapy, cataphoresis, desincrustation, or brushing? If you chose D, brushing, you are correct. What type of skin treatment can assist the body in producing vitamin D? Is it ultraviolet lamps, infrared rays, microdermabrasion, or microcurrents? If you chose A, ultraviolet lamps, you are correct. Which of the following relieves pain in sore muscles? Is it desincrustation, infrared rays, high frequency current, or ultraviolet rays? If you chose B, infrared rays, you are correct. For general facial or scalp treatments, no more than 5 minutes should be allowed for blank. Is it brushing, facial steaming, high frequency current, or hot towels? If you chose C, high frequency current, you are correct. With oily skin, the follicle size is blank. Is it deeper, smaller, rounder, larger? If you chose D, larger, you are correct. What type of products work best for combination skin types? Is it alcohol based, oil based, water based, water oil based? If you chose C, water based, you are correct. Cleansing creams are used to blank. Is it soften the skin, dissolve dirt and makeup, rebalance the pH of the skin, prevent moisture from evaporating? If you chose D, dissolve dirt and makeup, you are correct. Which of the following can work as an astringent? Is it witch hazel, humectants, emollients, paraffin wax? If you chose A, witch hazel, you are correct. What type of skin is caused by an insufficient flow of sebum from the sebaceous glands? Is it normal, oily, combination, or dry? If you chose D, dry, you are correct. Acne is a disorder of the blank glands. Is it Seborrheic, thyroid. Sebaceous, endocrine. If you chose C, sebaceous, you are correct. What type of mask uses hydrators and soothing ingredients to add moisture to sensitive or dehydrated skin? Is it cream, paraffin wax, clay, or gel? If you chose D, gel, you are correct. Blank masks are used to stimulate circulation and temporarily contract the skin pores. Is it paraffin wax, clay, gel, or cream? If you chose B, clay, you are correct. Which of the following is an example of a chemical exfoliant? Is it enzyme peel, emollient, granular scrub, or astringent? If you chose A, enzyme peel, you are correct. Toners are designed to blank. Is it draw impurities out of pores, add moisture to the skin surface, tighten the skin, or remove dead cells from the skin surface? If you chose C, tighten the skin, you are correct. The T-zone is the section of the face that incorporates the forehead, nose, and blank. Is it upper neck area, chin, cheekbones, lips? If you chose B, chin, you are correct. Proper blank and a water-based hydrator help keep oily skin clean and balanced. Is it exfoliation, massage, vibration, or circulation? If you chose A, exfoliation, you are correct. Masks help to blank. Is it loosen the skin, dissolve dead cell buildup on the skin surface, soften the skin, or draw impurities out of pores? If you chose D, draw impurities out of pores, you are correct. Astringents may contain up to blank percent alcohol. Is it 15, 20, 35, 50? If you chose C, 35, you are correct. High quality masks and packs should feel comfortable while producing slight blank sensations. Is it scratching, soothing, tingling, relaxing? If you chose C, tingling, you are correct. What type of mask employs the pack application method? Is it cream, paraffin wax, clay, or gel? If you chose B, paraffin wax, you are correct. A mask is a product involving complete closure to the environment on top of the skin. Is it setting, water-based, alkaline pH, or acid pH? If you chose A, setting, you are correct. Dry skin facials can be supplemented with blank rays. Is it UVB, UVA, infrared, UVC. If you chose C, infrared, you are correct. What type of treatment helps maintain the health of facial skin through correct cleansing, toning, and massage? Is it light therapy, corrective, microdermabrasion, preservative? If you chose D, preservative, you are correct. Alopecia skin is also known as blank skin. Is it dry, oily, normal, combination? If you chose A, dry, you are correct. The sebaceous material in a follicle darkens when it is exposed to blank and forms a blackhead. Is it cleansers, oil, oxygen, or water? If you chose C, oxygen, you are correct. This concludes this review. If you would like any other classes, please make sure that you visit our website at howardbrownonline.com.